Hello everybody, my name is Chris and the goal of this video is to introduce you to ActionADE and show you how to report an adverse drug event or ADEs using the application. So what is ActionADE? ActionADE is a web-based application that was developed, tested, and implemented by our research team. It gives healthcare providers a standardized way to document and share information about adverse drug events with other providers across different healthcare settings. The main goal of ActionADE is to reduce patients from being unintentionally re-exposed to medications that have previously caused them harm by communicating information across health sector through PharmaNet in order to increase patient safety. To understand why ActionADE was developed, let's first look at how ADE information is currently captured. Right now, community pharmacists enter information about dispensed medication into PharmaNet, which is BC's medication dispensing database. When a patient comes to the hospital, healthcare providers can access this medication information through a province-wide portal. The problem is that the current system has a few limitations. PharmaNet does include an adverse reaction field, but it's a free text field. That means people can document information in different ways using different abbreviations or descriptions, which can make it difficult to interpret. On top of that, healthcare providers working in hospitals, physician offices, and long-term care facilities can't add or update information in this field. Because of these limitations, many ADEs never make it into PharmaNet. As a result, important information isn't always shared between healthcare providers, which increases the chance that a patient could accidentally be prescribed or given a medication that has previously caused them harm. So why does ActionADE matter? Medications cause or contribute to approximately 8 to 12% of emergency department visits, and about 35% of these visits result in hospitalization. Based on emergency department statistics in British Columbia, this represents approximately 276,000 emergency department visits and 102,000 hospital admissions each year, with associated healthcare costs estimated to exceed $2.5 billion annually. These numbers highlight the burden that ADEs place on an already strained healthcare system. Improving how ADE information is documented and communicated can help prevent patients from being unintentionally re-exposed to medications that have previously caused harm. If you look at ADE-related visits, 1 in 3 ADEs were repeat events, and 3 in 4 repeat ADEs were probably or definitely preventable. The unstandardized documentation and suboptimal communication of adverse drug events were identified as major contributing factors. One of the key goals in developing ActionADE was to create a reporting platform that is simple, efficient, and easy for healthcare providers to use. We understand that time is a valuable and limited resource for clinicians, so we aim to develop a platform that is user-friendly. Our preliminary findings show that reporting an adverse drug event through ActionADE takes less than 2 minutes. Compared with other reporting platforms, ActionADE provides a quicker and more streamlined way to document and communicate AD information. ActionADE has also been associated with a 60-fold increase in adverse drug reaction reporting compared with the Patient Safety Learning System, or PSLS. This increase appears to be driven by ActionADE's ease of use and its ability to support meaningful communication between healthcare providers, ultimately helping improve patient safety. Now I'll show you how to access ActionADE and walk you through the process of submitting an ADE report. How to access ActionADE. There are a couple of ways to access ActionADE. Please note that ActionADE can only be accessed while connected to a VCH or a PHC network, or when using a VCH or a PHC computer. The first option is to access ActionADE directly through an internet browser. Simply enter actionade.vch.ca into the address bar, and you will be directed to the ActionADE platform. The second option is to access ActionADE through CST Cerner. To do this, click on the PSLS icon located in the banner bar. This will direct you to the BC PSLS Systems page. From there, click on the ActionADE logo, which is the bright orange logo. Once selected, you will be directed to the login page for ActionADE. You must have an account to log into ActionADE. To create an account, go to the login page and click the Request an Account button at the bottom of the page. You will be required to enter the following information: your first and last name, VCH or PHC network email address, your role, pharmacist or physician, practitioner ID, practitioner reference ID, health site, GP ID if you're a pharmacist. If you are a pharmacist and do not know your GP ID, follow these following steps. Go to PharmaNet enrollment website or search GP ID PharmaNet on Google and follow the link to Prime. Please note that you must be enrolled in Prime to access information. Select Renew or Update Information. Log in using the VC Services Card app, and your GP ID will be displayed at the top of your Prime profile page. Once you have entered and submitted all the required information in the ActionADE account request form, a member of the ActionADE team will review and approve your request. Once your account has been approved, you will receive an email at the email address you used to sign up. The email will include a link to the Terms of Use agreement. You must review and accept the Terms of Use agreement before you can access and use ActionADE. How to report ADEs using ActionADE. To report, log into ActionADE using your VCH or PHC network email and select the site that you will be reporting the ADE from. Once logged in, you will be directed to the main page of ActionADE. This main page contains all of the patients that have been reported to ActionADE. It has the patient's name, PHN, MedRec status, when the MedRec was modified, when the ADE report was modified, the ADE report status, where you can check whether the report was complete or not, and when the report was last edited by. You can view reports from other hospitals by clicking on the drop-down menu at the top right. To add a new patient, you simply click on the Add New Patient button. A pop-up will appear and you will enter the patient's PHN. Once the PHN has been entered, the first and last name, gender, and date of birth will be automatically imported, and you can also have the choice of importing all the medication on the patient's PharmaNet profile. We then click Submit. This is the patient's ActionADE report profile. You can see the patient's name and birthday on the top, all of the ADE reports that have been done for the patients on the top left, and all of the medication that is available on the patient's PharmaNet profile. To report a specific drug, go to the patient's ActionADE profile and either click Add ADE at the top of the page or select a specific drug that you would like to report from the patient's medication profile. If you selected a specific drug on the previous page, it will automatically be added as the suspect drug. However, if you click Add ADE at the top of the page, you will need to select a suspect drug on the reporting page. You can also add a medication by clicking the Add Drug button and entering the required medication information. At least one medication must be selected before you can complete the rest of the report. This is the ADE reporting page, where you will enter information about the adverse drug event. At the top of the page, you will see the patient's name and selected suspect drugs. The reporting form is divided into 3 tabs: Details, Treatment, and Outcome. Each tab contains different fields for documenting information about the ADE. Some fields are mandatory, meaning that they must be completed before the report can be submitted, and the information can be sent to PharmaNet and Health Canada. The mandatory fields are highlighted in yellow or marked with an asterisk. On the Details tab, you can select the type of ADE being reported. There are several ADE types to choose from, including adverse drug reactions, allergy, non-adherence, drug withdrawal, and others. To view the definition of each ADE type, click the I information icon beside the ADE type field. You will also see the symptom/diagnosis field, which uses the MedDRA terminology list. Here, you can document the type of symptoms or diagnosis the patient experienced because of the suspect drug. You can select up to 3 symptoms or diagnoses. If you cannot find the appropriate term, you can search online for the symptoms along with MedDRA or click the trouble finding the right term. This will direct you to a page where you can search for the most appropriate MedDRA term. You can also enter any relevant laboratory data. As you continue scrolling down the Details tab, you can document when the ADE occurred, along with other relevant information about the event. Once you have completed the Details tab, you can continue to the Treatments tab. Under this tab, you can document what happened to the medication and any treatment provided for the ADE. Each icon corresponds to a different section: recommendation, order, or treatment. Under the recommendation or order section, you can indicate what action was taken regarding the suspect drug. You can select from the following options: given per PharmaNet, given per verified medication history, discontinued, or changed to. If you selected change to, a new entry will appear where you can enter the information for the medication that replaced the suspect drug. If the ADE was treated, check the box labeled ADE has been treated. You can then select the relevant actions that were taken to treat or manage the ADE. Once you have completed the Treatment tab, you can continue on to the Outcome tab. In the Outcome tab, you can provide information about the outcome of the ADE. In the Outcome field, you can select up to 3 outcomes that occurred as the result of the ADE. These can include an emergency department visit, hospitalization, a life-threatening event, worsening of a pre-existing condition, and many other outcomes. You can also indicate whether the AD was an acute or a chronic event. In the What Happened After Treatment or Challenge field, you can select the patient's outcome following treatment or a drug challenge. The available options include complete resolution, improvement without resolution, no change, worsening, or unknown. Under certainty level, you can document how certain you are that the suspect drug caused the symptoms or the event experienced by the patient. You can select certain, probable or likely, or possible. There is also a refuted option, which I will discuss later. Once you have completed all the fields across the 3 tabs, especially the mandatory fields, which are marked with yellow highlight or an asterisk, you can select Save to submit the report. So let's say we want to report warfarin sodium. So we go back to the Details page, click on the warfarin sodium, we select the ADE type. So in this case, we're going to select adverse drug reaction, and the symptoms that we're seeing is intracranial hemorrhage. So we can look up intracranial, and it will pop up the hemorrhage intracranial for me. And then I don't have any relevant lab data. And the ADE occurred on today, let's say today. So now we go to the Treatment tab. Let's say that there was a recommendation to discontinue the medication. And now we go to the Outcome tab. So for the outcomes, there was an emergency visit, there was a hospitalization, and this was a life-threatening adverse event. Let's say that this event was also an acute event, and we are certain that the hemorrhage that we're seeing was from the warfarin that the patient took. So there we go, we click on certain. And then to submit, we just click Save. Once you click Save, the ADE report is complete. You can view the report from the patient's profile by clicking ADE report at the top of the page. Here you can review all the information documented in the patient's report. You also have the option to print the report if needed. To confirm that the report has been completed, return to the main ActionADE page and check the ADE report status. A green check mark indicates that all mandatory fields have been completed. A red X indicates that one or more mandatory fields are missing information and need to be completed before the report is finalized. How to refute a report. You can also refute an existing ADE report if you receive additional information indicating that the medication or the event was not actually an adverse drug event. To modify an existing report, click on the ADE report and select Modify ADE Report button located at the bottom left of the page. Next, go to the Outcome tab. Under the Certainty Level field, select Refuted. A Report Refute Reason pop-up window will appear. In this window, select the most relevant reason for the refuting report, then click OK. Once you have completed the required information, click Save. A strike-through will then appear over the ADE report, indicating that the report has been refuted. The certainty level will also be updated to refuted along with the reason the report was refuted. And there you have it. That is how you report to ActionADE. I just want to let you know that right now, ActionADE is being rolled out as part of a randomized control trial. The goal of this study is to see whether sharing AD information through the platform helps in reducing repeat adverse drug events. Because it's part of the study, reports of allergies, adverse drug reactions, and non-adherence have 50% chance of being sent to PharmaNet. This randomization helps us compare outcomes and understand how effective the platform is. The one exception is that if an event is considered life-threatening, that is, if you select life-threatening as an outcome in ActionADE, the report will automatically be sent to PharmaNet. If you have any questions or have any issues with your account or reporting, please do not hesitate to contact our support, which is actionade.support@qbc.ca, or you can also call 778-238-0152. You can also visit our website, actionade.org, for more information and updates about our study. Thank you.